the news of this comes on the day that Ohio prisons are set to take in prisoners for the first time after suspending intakes a while back to try and control the spread of the coronavirus. Now, as for what the governor will talk about today at 2 o'clock or in just a moment or two at this press conference, we didn't get a whole lot of advance on this one. We'll see if he addresses the situation from the weekend in which restaurants were allowed to serve customers in outdoor seating areas for the first time. That led to some bars having some big crowds and also to allegations that the bars didn't do enough to enforce social distancing. One Short North bar owner got 2 letters from the health department, decided to close for a little while. Now, the governor did speak, as I said, on CNN over the weekend, saying that the state is going to do what it has to get that situation under control, and the governor reiterating something he said last week, that he doesn't want to open the state up only to have to shut it down again because of a spike in the coronavirus and the number of cases that we have. Now, reporters, of course, have been selected randomly for the questioning order. ABC 6 selected dead last today, so we'll see if I get a chance to ask a question about any of this. But that's the scene right now as we wait for the governor and the lieutenant governor and Dr. Amy Acton to approach the podium. Terry?
All right, Tom, thanks. We look forward to your update tonight at 5, 6, and 7. Well, Columbus was not alone. All across Ohio, health departments received complaints about patios not social distancing. The Cuyahoga County Board of Health received 4 complaints over the weekend. In Cincinnati, the city warned that officials would fine or even shut down restaurants that were not following the guidelines. Places like the Blind Pig and Over the Rhine's Rosedale also subjects of social media backlash, that according to the Cincinnati Enquirer. Another possible topic that the governor could tackle, health care in African American communities, especially when it comes to COVID-19. Last week, DeWine said that the state has some work to do to improve medical care there. He said a large number of COVID-19 cases involve African Americans. The State Department of Education wants parents' feedback as they continue to work on a plan for possibly reopening K-12 schools the next school year. State education leaders have asked the Ohio Parent-Teacher Association to come up with feedback to their draft reopening plan. The Ohio PTA has set up a short online survey for parents, and they're asking 3 things. What are your main questions? Will you send your child to school if they reopen in the fall? Will you send your child to school if masks are mandated? As ABC 6 reported last week, masks are currently part of that draft proposal that's being offered as a, quote, discussion guide for local school districts. Golf courses around Ohio can reopen on May 26th, but only if they're up to par with a variety of regulations designed to limit the spread of coronavirus. The new rules limit golfers' interaction and the touching of surfaces. It also requires golf course workers to regularly clean and sanitize the facilities and to stagger employees' work schedules and break times. And we last heard from the governor last Thursday, and as you might recall, he had a slew of reopenings. To recap, beginning on Sunday, May 31st, child care providers and day camps will be allowed to reopen if they can meet safety protocols. Right now, the governor getting ready to address the public, address reporters. Let's listen in.
Today I'm wearing a University of Findlay tie. Fran reminded me as I was leaving today that the university's museum is home to more than 14,000 pieces of artwork from picture books, making it the largest, most diverse collection of picture book art in the world. They got some amazing children's books art there that we have enjoyed seeing. Also want to mention Lydia Mihalik, who is our director of the Ohio Developmental Services Agency, is a 2002 graduate of the University of Findlay and was also a member of the Findlay Oilers women's basketball team. We're opening today with a video that we received from the Greater Dayton Regional Transportation Association. Public transportation remains an essential service during these times of crisis. Without it, many of our fellow Ohioans simply could not get to their jobs, to the grocery store, pharmacy, and that's what they depend on. In Dayton, RTA buses carry 30,000 people each day. For many, RTA is the only option they have to access critical life-sustaining medical appointments, grocery, and pharmacy stores. want to thank the RTA and our other public transit systems in Ohio for all they are doing each and every day. So, Eric, let's see the video. This week is National Emergency Medical Services Week. It's a chance to recognize and thank the paramedics, the EMTs, ER doctors and nurses, all of those who respond to 9/11 calls, who transport people to our emergency departments for treatment and health crisis situations. These men and women provide the day-to-day life-saving services of medicine's frontline. They are brave, they are true professionals who dedicate their lives to helping others. So thank you to each and every one of you for what you do. We appreciate you this week, and we appreciate you every single day. Thanks for your great work. We continue to get some inquiries. I got some this weekend about visitation policies at hospitals. And I know that during this coronavirus, it's difficult. There's some difficult decisions that are made about.
The life safety system is being conducted.
Okay.
8002036 tested successfully.
Okay. I guess the test worked.
Good to know.
Good to know. Whatever. But getting back to the hospital rules, we know that these are just tough situations today when hospitals are trying to deal with the COVID-19 and stop the spread, but at the same time, loved ones want to see loved ones. We have no rules. The state of Ohio has not issued any rule. Dr. Acton has not issued any rule in regard to visitation. We have not done that throughout this COVID-19. So these rules are being set by the individual hospitals. So I want to make sure that people understand that we are not setting those rules for the hospitals. They are making these decisions based on what they think is the best as far as from a medical point of view. But we have nothing to do with those rules. Last week we talked about that we would be focusing on the work of our minority health strike force. And I want to thank the members of that strike force who are working. My team and I have had several conversations this weekend about the strike force and recommendations, and really about our obligation in Ohio to protect our most vulnerable members of society, our most vulnerable populations from COVID-19. On Thursday of this week, I will be talking more in depth about what we are doing with that task force, what some of the recommendations are, some of the things that we have already done, and some things that we intend to do in the future. So we will be doing that on Thursday. Again, if you look at the numbers, as Dr. Acton has pointed out, the death rate from COVID-19, for example, among African Americans is stunningly high. So we will be looking at that on Thursday and talking about what we have done and what we intend to do. Yesterday, the Ohio Department of Mental Health and Addiction Services received notice that one of their patients at Twin Valley Behavioral Health Hospital in Columbus, who had symptoms of COVID-19, did in fact test positive for the virus. Later, two other patients in the same unit got back positive results. In response to to these positive tests, the department notified the Ohio Department of Health and the Ohio State University for consultation. Ohio State is working with the Department of Mental Health and Addiction Services to arrange for testing of all the other patients in that 25-person unit. Testing will be conducted in an on-site designated area. Patients in the unit are currently quarantined, and those who test positive are being isolated to prevent the spread of COVID-19. All patients in the hospital are screened multiple times a day, and staff members are screened at the beginning of their shifts. This will, of course, continue. All impacted staff have been notified and are being actively monitored for symptoms and are being urged to be tested. In addition, members working in this unit are now using full PPE, including masks, gowns, gloves, shoe covers, and face shields. The hospital has stopped taking new civil admissions and is working with alcohol, drug, and mental health boards in impacted counties and local psychiatric hospitals in Franklin County to divert patients from there. The Department of Mental Health and Addiction Services has been monitoring developments since the beginning of the COVID-19 crisis and has taken action to prevent the spread of the disease in their hospitals. The department will continue to work with the Ohio Department of Health and Ohio State University to try and keep patients and employees safe and healthy. Updates on the COVID-19 situation at the state's behavioral health hospitals are made every afternoon, and you can check on those. They can be found on the coronavirus website at coronavirus.ohio.gov, coronavirus.ohio.gov, and those are posted every single day. I want to talk a little bit about restaurants and bars. I've always tried to be blunt, straightforward about everything that we are finding, and we try to share with you all the information that we have. I have been very candid in saying that in this reopening phase, a new chapter in the COVID-19, there is risk involved. There are significant risk, but there are also significant risk if we do not open up, and we've talked about those as well. So we can do two things at once, and it's up really to all of us to make sure that we open our economy, get people back to work, but do this in an absolutely safe way. The protocols, the rules for reopening bars and restaurants were laid down very, very clearly by the working group that we put together, made up of health officials, but also made up of people who run bars and people who run restaurants. The truth is that our economic recovery in the state of Ohio is tied directly to how successful we are in preventing the spread of the coronavirus. Stopping the spread, interrupting the spread of the coronavirus will determine how successful we are in opening up our economy. These two are tied together. You cannot have a successful reopening of the economy if we get surges in the coronavirus. And so these two are as linked together as anything can be linked together. We are talking about the slowing of the spread, and the basic facts have not changed. That can only be done by distancing. Spread of the disease, distance. more distance, the less spread of the disease. There certainly is an inverse relationship between the two. Very, very important. And so as we look at how our restaurants operate and how our bars operate, the distance is absolutely the key thing. As we got reports, and we're still getting them from health departments all over the state, but as we got reports over the weekend, it was clear that most restaurants were doing an amazingly good job. Most bars were doing a good job. But it's clear that we have had some outliers, ones who just were not doing what they should do. If we're going to make this recovery, if we're going to bring the economy back, people have to feel safe when they go out. They have to feel that the rules are being followed when they go to a restaurant. They have to feel that the rules are being followed when they go to a bar. So let me read from the order that Dr. Acton signed, and again, that was based upon recommendations from. Let me pull this up. I have it right here. This is based on recommendations from the working group. And I'm just going to read part of it. Restaurants and bars to reopen. All restaurants, bars, and other like businesses and operations in the state which have the on-site consumption of food, beer, wine, and liquor are permitted to reopen for full dine-in service within the state so long as all workplace safety standards are met. These businesses and operations are encouraged to either reopen or remain open if they have not ceased operation during the prior stay-at-home order. Business and operations shall continue, and here we get to the key part. Business and operations shall continue to comply with the social distancing requirements as defined in this order, including by maintaining 6-foot social distancing for both employees and for members of the public at all times, including but not limited to when any customers are standing in line. Reservations are to be limited to more than 10 persons. Customers, and here is a key part, particularly for the bars. Customers must be seated when consuming food, beer, wine, and liquor on the premises of the business. So it applies to restaurants, applies to bars. Customers must be seated when consuming food, beer, wine, and liquor on the premises of the business. And it continues on, but that is a key part. So what we saw in some bars this weekend with pictures, some pictures that made national news, we saw where in some places customers were not following the rules and the people who were running the bar were not taking responsibility. So both have to do that. The owner of the bar, the people who are running the bar, they have an obligation to control the environment. And if they cannot control the environment, they should make the wise judgment not to open. Or if they get in a situation where they can't control it, they need to close. I want to talk about enforcement. And again, I want to make it very clear. At least as far as we could tell, the majority of restaurants were doing a great job. Most of the bars were doing a decent job, but there were some outliers, and this jeopardizes, frankly, our ability to move forward as a state. So I've asked our team to come up with a plan, and they have the following plan. We are marshaling all the resources at our disposal to assemble a large contingent of law enforcement and health officials from across state agencies and from our local communities. We will coordinate with them as part of the Department of Public Safety's Ohio Investigative Unit, known as OIU, and the work that they do. So we're going to bring in people from different departments and put them into that unit. So they will surge in to conduct safety compliance checks in crowded bars and restaurants. They will issue administrative citations that can result in the revocation of liquor licenses. Further, they will work with municipal prosecutors to take potential criminal action against these bad actors. So that is what they will be doing. We will be working very closely with local officials on this. The local health departments will stay involved as well. The Ohio Department of Veterans Service operates 2 nursing homes for veterans in Ohio, one in Sandusky and the other in Georgetown. Due to the department's proactive work, which really began in February to keep the virus out of these homes, we've had no positive cases of COVID-19 among residents until just recently. Now, one staff member at the Sandusky home tested positive, and that was actually in mid-April, and did not return to work. But then on Thursday of last week, 4 residents at that facility tested positive. So we are committed to doing absolutely everything we can to protect each and every veteran in these homes. These men and women served our country. They protected us, and we are committed to protecting them. Last week, I directed Veterans Service Director Deborah Ashenhurst to arrange for the testing of each and every resident and staff member in both homes in an effort to limit the spread. The rapid mobilization to get this testing done right away, frankly, was remarkable. The local health departments and the local medical facilities stepped up and were very, very helpful, as did our team at the Ohio Department of Health. In Georgetown, members of the Ohio National Guard responded over the weekend to take the testing samples, and the Ohio State Highway Patrol transported the test to and from the facility. As of today, nearly everyone in both nursing homes have been tested. That's more than 700 staff members and more than 500 nursing home residents. We are also providing testing to Sandusky's independent living facility for veterans. That testing was completed this morning. While we're still waiting test results for around 50% of the cases, about 50% of the individuals, this is where we are as of today. There are still 0 positive cases in the Georgetown facility. In Sandusky, we now have 23 confirmed residents and 3 confirmed staff. A total of 508 staff and residents have been tested negative so far. Of the residents who tested positive, they're receiving around-the-clock care in the home's enhanced care facility and at Firelands Regional Medical Center, which is Sandusky's partner hospital. As test results continue to be returned to our Ohio Veterans Home, we'll keep any veterans testing positive in the enhanced care unit so they're separated from the others and so their care can be closely monitored. Also, the veterans' homes have enhanced their internal communication so that residents, staff, and family members receive immediate information. They've also begun posting updated data about testing in both facilities on our website, coronavirus.ohio.gov. I would like now to introduce you to another Ohioan who has successfully battled COVID-19. Stacy from Northeast Ohio. Her battle was certainly not an easy one, and she'll tell you about it. She wants to tell you her story in hopes that those who hear it will do all they can to prevent this from happening to other Ohio citizens. Stacy was in the hospital for weeks. She spent days on a ventilator in a medically induced coma. Her family believed she was going to die, and she almost did. Stacy, thank you for joining us. We are very, very grateful, and would invite you just to kind of tell us a little bit about your story.
Hi, thank you. I just want to commend the swift shutting down of Ohio. I feel that because of those actions, it contributed to saving my life. I put myself in a self-quarantine 2 weeks before I knew anything was going to happen with the state of Ohio. And I still ended up getting COVID-19. I was exposed on March 8th, and by March 21st, I was in Geneva emergency room with double lobe pneumonia. They admitted me, And within 24 hours, they were intubating me and shipping me downtown. And I don't remember anything else from there. I had an appointment today with Dr. Gold, the surgeon at Geneva Hospital, and he was instrumental in saving my life. He made a profound comment today that had there been 10 to 20 more patients flooded with what I had, I probably wouldn't have made it. So he said that he will never forget me, and I'm grateful that he saved my life. I'm grateful that they intubated me and got me on the ventilator. And the one other thing that he said, as far as my life being saved downtown at University Hospital, was that I was in a prone position, that they were able to do that for me. The care was incredible. I'm just grateful for the way that your cabinet has handled everything, Dr. Acton. And I can't stress enough to people, when this first happened to me, I said to my niece, this is a very serious thing and people need to know it. And I want to be able to be a voice and tell people, you know, whether or not you have immunosuppressed system or not, we all need to be mindful of each other and ourselves, to wear the masks and to wear them responsibly. If we know we're going to be in public and we know we have a compromised immune system, then wear the mask. Or don't go out if you're concerned or afraid. I just can't stress enough that I just wish people would be more mindful that this is really something real. My 2 months flat on my back and being paralyzed were something I'll never forget. Getting better, and I'm walking a little bit in the house without a walker, and I am going to get better, and I know that I will.
Well, wow. That's a gripping story. So you said 2 months on your back, basically?
2 months on my back in the hospital.
Oh.
Yes.
Wow.
Towards the end, they had me in rehab at the Hannah House, and they said that I would be walking by the time I left there, and I didn't believe it, but the staff there is so competent and amazing that they did have me walking and doing things for myself.
Dr. Acton? Any questions?
It was profound.
We'll see if Dr. Acton has any questions for you.
Sure.
No, I just, again, so nice to meet you and so good to hear your story. I guess we never know what something's like till we go through it. I mean, to hear you try to tell us so we don't have to experience it ourselves. How's your family doing? I bet they're thrilled.
Well, my one son's having a little bit of trouble withdrawing. A little bit. I think he's in denial that this happened to me. He's 20. He's afraid of the virus. My other son's 23, and he's gung-ho, get back to work. We can do this. People, protect yourselves. And I have an older son who's 29, and he's been working from the very beginning. So, he has concerns, but he's taking precautions. My husband's the one who had a hard time, and my dad, my sister.
Yeah, I'm sure. Wow.
Dr. Gold said that he honestly thought when they shipped me downtown that I wasn't going to make it. So hearing him be happy that I was seeing him today and that I was okay, wow, I think has made an impact on his life and mine.
Aw. Well, we are so glad to see you here today. Really glad.
Thank you very much for sharing that story with us. We're good luck.
Thank you.
You can
Thank you for
continue
all
your
the work
journey.
and the quick action that you took for our people in Ohio, and I hope others follow.
Me too.
Stacy, thank you.
Thank
We
you.
appreciate it. Thanks for
Be
being with
well.
us. Appreciate it very much.
Thank you.
Thank you. Those working at our prisons are among Ohio's frontline heroes. We thank them very, very much for their work. Very sad to report that COVID-19 has taken the life of another member of the Ohio Department of Rehabilitation and Corrections family. Bernard Atta had been a nurse at the Correctional Reception Center in Orient since December of 2012. He'd been off work since May 8th after showing symptoms of COVID-19. He subsequently tested positive. He was just 61 years old. He died at his home yesterday morning. Our condolences go out to his family and to his colleagues. I've asked DRC Director Annette Chambers-Smith to join us today to give us kind of an update. She did this several weeks ago, but to discuss the latest measures underway in our prisons and how things are going. Director, thank you for joining us.
Good afternoon.
You want to just kind of go ahead, Director.
We did have another staff person pass away, as you mentioned, and Nurse Bernard Atta will be missed by his family and his correctional family, but also by the patients that he faithfully treated and served. He was one of 12,000 staff that come to work every day, even though they know there's COVID all over the prison, and they do their job and they take care of the people that are there, and they care. We've had 3 staff members pass away from COVID, as well as 61 incarcerated adults. And we feel every single one of those. We work every day to try to not have another. This is a vicious disease, and not everyone is making it through. We don't work alone. We get help from specialists, from environmental health specialists to epidemiologists, infectious disease specialists, physicians, hospitalists, all to try to do the very best we can for our patients. We follow the CDC guidelines for prisons and have them implemented everywhere, and we QA those to make sure that we have quality assurance and that things are happening everywhere. We have 2,100 fewer people living in our system than we did when this started, or as of March 24th, and that helps us spread people apart farther. As you mentioned, social distancing is one of the very important things in terms of trying to control the spread of this disease, and that's the one luxury that we really don't have in the Department of Rehabilitation and Correction. We have more space, but we don't have huge amounts of space. We did start testing our patients early on with signs and symptoms, as was recommended by the health department at the time. And those recommendations have evolved over time with availability of testing and with additional science. The next evolution we took was to mass test, and we did that at 3 facilities. We thought we would find asymptomatic people, a 20%, maybe 30%, that we could move elsewhere and sort of quarantine off so that everyone else could be safe. But we found that testing is really just a point in time. It doesn't really tell you about people who have incubated and they don't have enough viral load to make a positive. And it doesn't really help you if you find out that 96% of your positive people are asymptomatic and positive, rather than the 20 to 30% you thought you were going to find. So once we really found that kind of spread, something that Dr. Acton said and taught us early on is certainly happening inside the prisons. And that is, she said repeatedly early on, we may get to a point where community spread is so vast that testing is no longer recommended. And while thankfully we did not get into that situation in the state of Ohio, we have gotten into that situation in the Department of Rehabilitation and Correction. So armed with all this knowledge, what should we be doing? Well, we should be treating people, and that's what we're doing. We're looking for signs and symptoms. We're treating people. We have a new testing plan that we're following, and it's based upon, interacting with the experts as well as utilizing the science of what we found going on inside prisons, because we were the first people to mass test. We're the first people to get results back, and now we're going to be the first people to evolve, because we need to do things that help us take action to help people and save people. We are using this new testing plan at Belmont Correctional Institution. I think over 200 people have been tested there already. Some of the elements of this new testing plan involve testing people on the way into our system and then quarantining them for 14 days and not allowing them to leave reception for 35 days. This process has revealed a female that was received at the Ohio Reformatory for Women Reception Center, and she was tested positive upon entry. And so therefore, we're now testing the people that she lived with to make sure that it hasn't spread to them. Now we have to wait an appropriate number of days so that we're not testing so soon after her arrival that it didn't have time to incubate and grow in someone else's system. Once that time period has passed, we will be testing them, and they're in quarantine now. The medical director can order whatever testing he thinks is appropriate. So he orders testing for signs and symptoms, yes, but he will order testing for other reasons as well. And he bases those on things like the physical plant of the prison, the health and age of the people living in the prison, and different items like that. So he may test an entire unit. He may test people in a unit. He may get enough testing to determine that he thinks it's pretty much spread everywhere, and then he would cease testing and just begin treating. So it's based upon his clinical decision making. We also test people pre-surgery, and we test people on the way out. If you are leaving early, we will keep retesting you until you're negative, and then you'll leave. And if you're leaving on time, we would test you and keep you quarantined after testing. And then if you are positive, we would give you a letter that's based on information from Dr. Acton's order that would allow the community and local health department to work with you and make sure you're quarantined the proper amount of time before you begin to mix with other people. I say all that to say that we are testing when it is actionable, testing when it helps someone, testing when someone can be either quarantined safely away, not put in contact with someone else, or when it's their health care is going to be impacted. So that's kind of how our testing system works. We also screen our population. So at a place like Belmont Correctional Institution where there are positive people, we would screen every single inmate there for symptomology and temperature, and also we would use a pulse oximeter to make sure that they still have adequate oxygen saturation. At this point, we've tested about 17% of our entire population in the department, and we continue to test wherever we think it's clinically appropriate or where we can impact things. The next evolution we're going to be making is to utilize antibody testing, and we've already done that at least 3 facilities, and that helps us further understand what's going on in a prison. The totality of this helps us make sure that we can operate as safely as possible for our staff and for our inmates. Marion was our hotspot at one point, and they've come out the other side. They have like 1,600 people that have recovered, and that's great. That's what we like to see. That's obviously the goal. But our hotspot now is Belmont Correctional Institution. So we've done some things like surge in the National Guard. We've put SRT members and STAR members in there from other prisons. We also are utilizing the Highway Patrol to make sure that we can staff while the people who work there that are ill have time to recover. We are using multiple hospitals, multiple ambulance contracts. We've brought in, things like oxygen concentrators and mobile showers so that we can use non-traditional housing and segregate people that are ill or put them in places where the staff can easily care for them. This is not easy, what we're doing, and the people at Belmont Correctional Institution they're a team, and they're really doing great work. I know there's a lot of COVID there now, but for weeks that facility was able to keep it to just one unit. And that may not sound like much, but when you're talking about COVID, and as the woman before me said, if you have everyone show up sick at the same time, you can't handle that. And Belmont's done an excellent job of keeping it contained to one unit for a lengthy period of time, which allows that unit to be in recovery. And now, yes, it's going to other places, but it's not all happening at once. That's about the staff doing the right things every day. We can't stop it. It's open living. There is no real social distancing. We've got people 6 feet apart now, but that's not adequate when you live there all day, every day, right? So if it wasn't for the efforts of that staff and the teamwork of that staff, everyone would have had COVID at the same time, and it would have overwhelmed the community, and that's not what has happened. We really will continue to fight every day, but just understand that a prison system is not a place when it's open bay living where you can keep COVID out for any length of time, and it's not a place where it's not going to spread. So we have to deal with that as best we can every day, and that's what we're doing.
Director, I may have missed it, but did you mention at Belmont what you're doing in regard to the testing and also PPE for the staff?
Yes, regarding testing, there's been several evolutions of that in the department across the time we've had the pandemic. At this point, though, they're going to be using a local hospital, and they just call and make an appointment, and they can be tested whether or not they have symptoms. Also, I know that there's...
Right, that's for the
employees. Yeah. Yes. And then as I stated, for the people that live there, we follow the testing plan I described earlier. Then your other question was about what?
PPE.
Okay, so PPE, yes. Now we have enough surgical masks on hand to give a mask for every shift to every person who works inside the prison. And of course, the people that live in the prison have 4 cloth masks that they rotate and clean, and then we replace because they're only good for 15 washes. I think that the problem with PPE, and the reason you hear so much about it, is because not everyone agrees on what type of PPE should be used under what circumstance. And we follow CDC guidelines in a department. I feel it's important to have some kind of authority, give us guidelines that tell us what to do when, because everyone has an opinion about what ought to be happening. And I think we should use the expert's opinion and make sure that we implement it across the board faithfully. That's probably the best that we can do at this point.
Director, thanks for the report. We'll have you back in a couple more weeks. We appreciate it.
Thank you.
Thank you very much. Lieutenant Governor.
Thank you, Governor. Good afternoon. I have 3 items to cover today. The first may be somewhat redundant, but I feel it's important. I've spent the good part of the last month reviewing the work of our various work groups, including the one that I want to talk about today, which is the work group on restaurants and bars and the compliance issues that arose over the weekend. Remember, outdoor dining started on Friday. Indoor will start on the 21st. And we have that work group did a great job at trying to put protocols in place that could be followed, that people could comply with. They tested them with all different types of owners. These rules must be followed, not for our benefit, not for the director, the governor, or mine. They must be followed for the benefit of all, benefit of the public, you, the people who are watching this news conference and everybody else out there who you love and care for. It's for the employees to keep them safe. And it's for the customers who want to help a business owner, want to go enjoy a meal and perhaps a drink, but we need to do it safely. And that's why those protocols were put in place. And I want to be clear, today is, again, an education process on this. Patrons must be seated. They're required to be seated. There must be a seat for everybody who's consuming food or drinks. And open congregate areas must remain closed. There's no more than 10 people to a party, to a table, and all those tables must be 6 feet apart or separated by a barrier. And if you can't do this as a business owner, because you're accountable for this, it's not your patrons that are accountable, and yes, we expect them to be, but ultimately you're accountable for this, and if you cannot do it, then you cannot open. And this process that we continue to go through is to educate you, because we want you to comply. We don't want anybody to be out of compliance, because we don't want to enforce it. Enforcement's the last straw, essentially. None of us want to get to that. But if you can't comply, and if you won't comply, and if you won't keep people safe, your customers and your employees, then there has to be enforcement. It's the only way this works for us to keep people safe. And also know that local officials can go above and beyond what the state standard is in this. So if there are particular problems, say in an entertainment district or in a community, the local officials can set stricter standards and even close those types of facilities for operation. So I want to be clear about that and help to educate folks so we get this right. We are all in this together. Nobody wants to see a couple of folks ruin the situation for all, because as the governor mentioned, we got to keep people safe, each other safe, so that we don't have the spread, so that we can get the economy moving again, we can build confidence and keep people healthy. Second item that I'd like to discuss is around sports leagues, gyms, fitness centers, which we discussed last week, opening up on May the 26th, particularly sports that are non-contact or low contact, like tennis, paddle sports, golf, baseball, and softball. And I mentioned we are working on standards for other sports that are contact or low contact, at least for the training portion of those. That in that order and in that discussion we had last week, it did not address and did not involve your school-related sporting activities. Well, this morning I spoke with Jerry Snodgrass, who's the executive director at the Ohio High School Athletic Association. We are going to begin to coordinate with them on protocols for training and preparation for school-sanctioned sports. We know that this school year is nearing the end, but for the athletes out there, we know that training is a year-round process. We know that properly trained, properly fit folks, it's an important thing, not just to excel, but to lower the risk of injuries and things like that. We don't know what the school and fall will hold at this point in time, but we do know, like with gyms and fitness centers, that non-contact sporting activities and the training for even those that are contact, that there are many ways that you can do that are safe. And we know that you want to keep that future in mind. Everybody wants to have something to hope for. Keeping ourselves fit and trained is important. We know the schools and parents and the student athletes are looking to prepare for that future, and we will work with the Ohio High School Athletic Association to develop protocols to make sure that we limit the ability to spread COVID-19. That's the goal of everything we do, is to limit the spread, to keep people safe. So we will begin the process of working with them on what that might look like. More information to come on this conversation in the near future, but wanted to clarify that. And then finally, on churches. It always seems to pop up. When are you going to open churches? Churches have never been closed under the director's order and the governor's supervision of that. Churches have not been closed. Many churches have chosen to close because of their responsibility to keep their parishioners safe, and some of them have opened following appropriate guidelines. But remember, the distancing, the disinfecting, the masks, all of those things help us keep each other safe. It's important that we all make sure that no matter what we're doing, as we're going back out in our workplace, in our personal lives, that we know what works to control the spread, and that we are holding each other accountable in that, and that we are looking, I guess since we're talking about churches, to be our brother's keeper, to love our neighbor as ourself, and to try to make sure that we're responsible in these activities. Governor?
Dr. Acton.
Thank you, Governor. Good afternoon, everyone. Let's start with our numbers. First of all, right now in Ohio, we have 28,454 cases, an increase in the last 24 hours of 531. And we have at this point 1,657 Ohioans that we've lost to COVID. That was 32 more reported in the last 24 hours. And I want to say, in hearing, losing our colleague at DRC, we know that every person is not a number, and we know there are just stories beyond stories behind these numbers. So I just want to say to the families, we don't take this lightly. And Stacy, her story is very important because I think it shows us that there's a lot more to this disease, and the morbidity is the term we use, not the mortality, Governor. And morbidity is how sick people can get and the impact of that. So it makes us take pause and makes us remember how very careful we do have to be. Moving on here, Eric. Really, we've tested now 270,000 in Ohio. We're seeing about the same levels. If we go to the next slide, we do, I overheard Andy Chow giving an analysis. We really are not seeing a lot different. This is a plateau, and in that plateau are a number of people who are still being sick and being hospitalized. Next slide. Our testing is increasing. We reached at one point one day over 10,000. Our 7-day average was in the high 9,000s. But more importantly, we have an incredible team of people. I spent a good deal of time this weekend, which is an outstanding group, working on an entirely new way of logistics. You heard the director talk a little bit more about how can we use our testing very wisely but deploy it very quickly. We're working alongside the National Guard, all our hospitals, our health departments, and particularly focusing on these congregate settings where we know there's such high risk. So again, I think we have a system we're building here in Ohio that I really think will move us forward, not just in the numbers we test, but in how we test effectively. And Governor, just want you to know your team is working really around the clock, and that is quite literal, waking up at 6 a.m. and to the next Zoom meeting all weekend long. So we'll have more to share about that. Next slide. I just want to take a moment each day. I thought I'd talk a little bit more, and there have been articles written about how we really measure our progress as we move forward. Again, we're learning a lot as we go. That will not change, I think, and you can see every state is struggling with this. Every country is struggling with this. So each day, again, I think I'll review a number that we're following here in Ohio, and one of them is the R-naught, a little bit of a statistical calculation. This isn't a modeling. This is a mathematical formula that really talks about the spread of infectious disease, and it's really based on how susceptible the population is to a disease, how infectious it is, but more importantly, the third factor, what we do to stop the spread of that disease. And a lot is said about, remember early on, we talked a lot about flu and trying to, decide was coronavirus going to be a lot like influenza. Influenza has an R-naught, which is the spread of disease, of around 1.2. So for every person who catches it, they have the ability to spread it to 1.2 people. And I can tell you that even at that level of a spread, in the winter, during high peak flu season, our hospitals can be at 95% capacity just from flu alone. So that is sort of a measure that we can look to. What we really want is it to be less than 1. Because that's when a virus starts to peter out, when I can't give it to another person or less than another person. And we know with COVID, we've seen anywhere at its peak from 2.5 to even in some studies as high as 5, so 1 to 5 spread. But right now in Ohio, fortunately, we're seeing us at about 1 to 1, and that's due to all the changes we've made. And this slide just shows that if you're at a 1-to-1 spread, you really can't get that logarithmic spread. We see that more in congregate settings when people are very close together. But when we can keep the social distance, when we can wear the mask as a barrier, we really help keep this disease from spreading. We keep people from getting sick, and we keep from overwhelming the healthcare system. But if we don't do those actions, one person can become 4 people, can become 16 people, and that goes on logarithmically. And that's, that will give us our next peak and our next surge. And so while we all, and I think the governor talked about, and not surprisingly, and we've seen this in history before, when you first open up a bit, people surge out back to life. But I really caution people to move carefully, because we really, the actions we're taking very quickly with this very infectious and very deadly disease can spread quickly. And RNOT, next slide, makes a little graph that looks something like this wave here you see. And we've done it for Ohio. The dotted line is a 1-to-1 person spread. We came originally up from about 2 to 2.3 in Ohio and drop down. We actually follow our zones. You've heard us talk about, we've divided Ohio into 3 zones, so we're following this number closely, and we can even follow it at a local. But we're down there numbers now, and we don't want to see that pick up as we start to move about. And if we see a number like flu, like a 1.2, or starting to go up, we'll pay attention to that and follow that in the days to come. So again, are not one of the many things besides cases, besides deaths, besides hospitalizations, and I'll teach you more of the numbers we're following in the days to come. Next slide. I do want to share this very nice slide. It was shared with me first by Dr. Rick Lofgren. He's actually the lead in Zone 3, which includes the Cincinnati areas and surrounding areas and the Dayton areas, and he is CEO of UC. And this graph was actually made by Mike Venerable at Cincinnati Tech, Cincy Tech, and he was trying to find a picture way to explain how important masks are. He's looking at the evidence, and he's just really showing that, remember, masks really help with the spread of the respiratory droplets, and it can decrease the viral load up to 86% of those droplets. That's astounding in many, many ways. But remember, keep the distance as well. It's Swiss cheese. None of these things stops it. Wearing this mask does not protect you 100%. Keeping far apart and wearing the mask in crowded situations and doing other things like washing your hands, all of that together gets you closer to that 100% and stops us from transferring this disease. So this is fascinating research. Thank you so much to Cincy Tech, and we'll have this graph on our website. And last, I want to share a little story. First of all, I never get the chance to thank people. There are so many acts of kindness that have happened, and letters and things that the 3 of us are receiving from people. And someday when all this is done, it'll probably take me a year to write everyone back and share some of the stories I've heard. Very touching stories. But this one next, do we have a picture? Oh, we don't. I want to tell a little story about Julia Hughes. Some of us in Columbus may have seen it, and it's made national media. This is a story of an 11-year-old girl from Hilliard who had been playing tic-tac-toe to stay from being bored. We're seeing a lot of things like chalk art and other things have a resurgence, sewing and masks and tic-tac-toe, her and her friends. But she started playing tic-tac-toe with her mail carrier as a way to pass the time in this new COVID lifestyle and time that we live in. And she made a little hand-drawn board, and she put it in her family's mailbox. And certainly her mail carrier, Letitia Wright, and her play tic-tac-toe every day to pass the time. And I see that as a bright spot in our day. It's the kind of little things that we're remembering again and doing for each other. So thank you. Thank you, Julia. Governor.
Dr. Acton. Ready for questions? Up here. Laura, Fred and I had Colonial Pizza last night. That's my report to you.
Oh, I had pies and
That was your
last
question,
night.
right?
Yeah, Laura Bischoff, Dayton Daily News. Governor, could you please give us some more details on this enforcement effort for bars and restaurants? Like you said, it's going to be a large contingent. How many people are we talking there? Do officers have to witness the infractions? And what sort of steps are there between citation and license revocation? And then lastly, were you surprised that some patios were packed?
Really an expansion of an already existing group that is in public safety under Tom Stickrath. I asked the team to take a look at this, and they decided to take the normal group, and Laura, I'll have to check on the number, but the normal group, is 70 people. That doesn't mean they're all deployed at the same time. They would not be. And we're going to increase that, and frankly, I don't know yet how big a group that will be. The truth is that we rely, frankly, on good behavior in most things. Most laws, most regulations, is people doing what they're supposed to be doing. And enforcement is not the way that, that behavior takes place. But frankly, this is so very, very important that we get this right, that we're going to increase the normal enforcement. We'll be able to tell you in a few days how many people will be involved. There's really two types of enforcement. One has to do with a filing under the criminal section. The other has to do with an administrative citation. I think this weekend, for example, there were several citations issued, one in Medway, Ohio, in Clark County. There was one issued in Columbus by this state group. In addition to that, though, you also have local health departments. And we have not gotten in the full reports from every health department around the state. I think I was told this morning that Columbus issued eight citations, their health department. But I don't have the numbers for the other cities. But that's separate from what I'm talking about. You got the health department enforcement, then you've got the group under public safety, the special investigation unit.
Were you surprised, though, that some patios were packed on a Friday and Saturday night?
No, look, I mean, people want to get out. It's a nice time. Nothing wrong with that at all. Again, I will say this: most restaurants did a bang-up job, great job. People had good experiences, and most bars were able to deal with it. But we had some that, frankly, were totally out of hand. And again, what do you look at? You look at the distance. The distance is the key. I mean, that is how we slow this spread down, is by distancing. And some just didn't have the distancing. And again, it's why I read the order again, and the Lieutenant Governor referenced it. People have to be seated. And that was done for a reason. That was done for a reason.
Thank you.
Control the distance.
Hi, it's Andrew Welsh-Huggins with the Associated Press. This is a follow-up question based on Director Chambers-Smith comments. I don't know if she's still there, otherwise for you, Governor. So we understand the changes that the Director outlined for the testing approach in the Ohio prisons. Nevertheless, Ohio does now have the second highest per prisoner case rate and the fourth highest prisoner death rate. With that context, I was wondering if you could explain the recent decision to allow new inmates to begin coming back into the system. Is this the right time to increase the DRC population?
These are decisions that are basically made at the local level. What we can control is the amount. We don't want people who are coming back who are positive for COVID. The director is no longer on the phone, I don't think. Eric, she's not on the phone. That is a question. One of the things that we decided today, the director had to go, but the director is available. If you want to call the director this afternoon, the director can give you answers to any of those questions. I would just say about the testing, look, we're going to follow the health department and the best medical advice we can get about testing. If testing helps with any inmate, we are going to test. I've given the authority to DRC to test as many people as they think or makes a difference, and so it will be as aggressive testing as is medically indicated. So that's wide open. Again, they're going to follow the best medical advice on that.
Thank you.
Jim Oddie from WHIO TV. Thank you, Governor. This question is for you. You've spoken to the liability of the license holders. I want to talk about the people who are in the crowd. What responsibility do they bear for what happened over the weekend at some of these locations? If you can't convince them that this is real, that this is serious, is there a way to persuade them? And secondly, could you cite them individually? Would they be? What do you think?
Could I do what, Jim? The last part? I'm sorry, I missed.
Could you cite them individually rather than just the licensee?
Individuals can be cited. Absolutely, individuals can be cited. We would not rule that out at all. Look, Jim, I think that we're all going through this in a learning process. It's nice outside. People want to get out. They haven't had the opportunity to go to a restaurant, go to a bar. Now they're taking that opportunity. And absolutely nothing wrong with that at all. But again, this virus is still here. This virus has not gone away. The facts have simply not changed. And so if we are going to open up the economy, if we are going to get Ohioans back to work, we've got to do it in a responsible way. We've got to do it in a way that keeps people safe. Because if we go off the rails here, if we go off the rails and we're not keeping people safe, and we're seeing the R-naught number, for example, Dr. Acton was talking about, we see that start creeping up above 1, 1.1, 1.2, alarm bells need to go off. And we're going to do what we have to do to protect Ohioans. We're not going to let us surge in regard to this. So again, this is a very delicate operation. This is a high risk, but it's a risk if we didn't do anything. And so to my fellow Ohioans who, at least by the pictures, didn't look like they thought that this remains a threat, let me just say it is a threat. And if you are not worried about yourself, you should worry about your mom, your dad, your grandparents. You should worry about strangers who somehow might get it from you. This is a case in your life, and it may be the only time in your life, we hope, where literally what you do every day and how you practice good common sense, keeping 6 feet away, wearing a mask, that is going to determine whether people live or die. Very few times in our life, maybe never, are we faced in a situation where we're doing something that can cost someone else their life. And I don't think there's any of us that when we really think about it, want to do something that causes someone else to die, or someone else, if they don't die, to be sick, as we heard today, for 2 months on her back in the hospital. So there's a lot at stake. We can do this, but to my fellow Ohioans, have fun, but keep that distance. When you go to the restaurant, you go to the bar, sit down. That's what the regulations say. That way, you can ensure that there is a space in there and that there is in fact a distance. Thank you.
Good afternoon, Governor. Randy Ludlow with the Columbus Dispatch. In the wake of the DRC Director's comments earlier, we continue to hear from correction officers and others inside prison who say, despite what I said, they still don't have full and appropriate PPE. And also you said you have given the Director authority to determine what kind of testing is appropriate. Why is mass testing no longer appropriate?
Well, I think she addressed that. And she is not here. You can call her after this is over. I'm going to let Dr. Acton take that because I've authorized as much testing as is medically appropriate. And if there's a way to save a life, if there's a way to stop spread, that is being done. We went into the Marion prisons and had, tested everybody. I think if you look at Belmont, there's a lot of people being tested. But it's not everyone that's going to get tested. So, Dr. Acton, you want to take that issue, please?
Sure, Governor. And again, I have not talked specifically with the director about this particular case, but I know she's been consulting with our medical team as well as other clinicians. And so I think it's really important to remember that you want the testing is not the treatment, and you want the testing to guide your contact tracing, especially early on when you can test and you can find someone and you can remove people from the situation and spread it out. You can actually use it as part of your strategy, and it's that's why we really, in our tiers of testing, ask that a clinician and health departments actually go into a facility and look at the layout, because every story is a little different in the disease detective work. Now, these tests, as we know, many people are asymptomatic, but also many people are too early in their disease process. So if you test on one day, it's actually one point in time. To really catch people, you have to do it. You'd almost have to do it every 3 days. And so when you're talking about mass testing, the big question is always like, what do you use that for? Will it change how you do your treatment? So for instance, something people don't know unless you've been tested, my husband was sick. I had the good or bad fortune myself of being tested because I wanted to make sure, he wasn't tested and then I was tested. And if you've had this test, you know that it's not a simple little test you do. It's fairly invasive. It's not necessarily comfortable having the swab put down. So it has to be done by medical professionals in a very distinct way. So it's not something like the finger prick that we're hoping for as the answer, where we could just take a little drop of blood and test people. So that's something you also really have to weigh. So there are many factors that go into testing. There is no limit, as the governor said. He will never limit in any of our congregate care settings the ability to do that. But what we're learning around the country now is how do we do that well and smartly and take the patient and the staff into consideration as well. So I think it's become a more complicated equation than just our wished for. If we could just test everyone, we would know everything we need to know.
Randy, let me just add to that, for example, in some prisons we've had 80% positive. And, the question is, you don't, at some point you no longer have the ability to isolate people. Again, this is, I want to assure everyone that the contact tracing is being done. When someone, let's say in Belmont or any other prison, is test positive, or let's say there is a member of the staff that tests positive, that contact tracing is done. Let's say it's a member of the staff. It's a contact tracing is done inside the prison, where they see who that person has come in contact with, but they also do it outside the prison, and outside the prison is done by the local health department. So it's the same basic principle that is used everywhere, that if you have sufficient testing, you do the testing, you do the tracing, you isolate, and you find out who that person has actually been in contact with. The difficulty when you're dealing with the prisoners, when it has spread throughout the prison, comes back to what do you do with that information? Because the treatment is basically the same, is my understanding. Is that right, Dr. Acton? Treatment's basically
the treatment is the same. And I think, too, one thing we don't want to forget, this has come up as we go back to work and in businesses, too. And I think, again, we wish that this testing was something that everyone could have and you would have a clean slate, but it just doesn't work that way. Not all the testing is 100% accurate as well. So it's just been a very complicated world of testing and using it to actually help us stop the spread of disease. And right now, the testing itself isn't a treatment. So, but we're using that testing, and we need to use much more of it, but use it wisely.
Hi, this is Jake Zuckerman from the Ohio Capital Journal. If an outbreak were to flare up in a given community, are you prepared at all to reimpose any of the social distancing measures that you're now lifting? And if you or Dr. Acton are not, is that something that a local health commissioner could decide to do if he or she chose?
We certainly are willing to do it if we have to do it. It's also something locals could do as well. So, any of the orders that we have issued, they can issue based upon what they're seeing locally. They can issue, more prescriptive orders. Health departments have the ability to do that. But we won't hesitate to do what we have to do to protect Ohioans.
Thank you, Governor.
Adrienne Robbins, NBC4, and my question's for Dr. Acton. We continue to see cases coming up in these congregate settings, and we hear about the complexity of testing in these places like our prisons. So even with widespread testing, until there's a vaccine, will the coronavirus remain a large danger to places like our nursing homes and prisons? And until there is a vaccine, do you foresee visitation being allowed?
You know, I think I'll share this with you. You know, we know congregate settings are very high risk, and whether they would be a workplace where people spend 8 hours together, whether it's our home, any place that we're in close proximity is going to remain a difficulty as we move forward, and that's why we have to take all the precautions we're taking. I want to say something about this. You know, I failed to mention this earlier. It had been on my mind, but healthcare, I really need people to get out there, not be afraid of going to hospitals right now and seeking healthcare. I know many of us delayed care. I will share with you that it's very difficult, this whole idea of visitors. And it's something that we have teams of people looking at very carefully. We're talking to experts all over the country to understand that, you know, the spread of disease, especially in nursing homes where people go from nursing home to nursing home to nursing home, which would not be unusual. As a physician, maybe I would visit several nursing homes. I then can be like transmitting that. And we saw that. We saw that early on in Washington, where we really learned about this virus. We saw it here in Ohio. And so at the same time, I just want to say this visitation thing is something that we need to keep looking at. You know, we're looking at how can we have more PPE. PPE shortage has been a factor in all of this. Now we're learning more about using masks. So these are policies we'll keep revisiting. My very own daughter had to use the healthcare system. She has a very bad tonsillitis and was hospitalized and is hospitalized right now. So Maddie, I love you. I know you're there, and it's very hard as a mom to not go in the emergency room with her. She's 23, we'll say that. She's an adult, but we all know that we like to have our advocates with us and people. And so I just want to say to people out there, thank you to our healthcare professionals, thank you to our nursing home people who are taking such loving care of the people we love, because this is probably one of the hardest things that I've heard from every friend with every parent in a nursing home. And this will be something we continue to look at as we move forward.
Hi, this is Danny Eldridge with Hannah News Service. I just wanted to ask about masks. It seems like the evidence is continuing to increase that places where it's required, the cases are going down, the spread's going down more. At what point will you consider mandating masks? I mean, people are not wearing them. They're not doing it on their own. Many people aren't. At what point will, you know, servers and bartenders be valued over people being uncomfortable?
We're going to do what we have to do to keep the spread down. But I truly believe that Ohioans, as they look at this, more and more Ohioans will be wearing masks. This is something that you don't do for yourself, but you do it for someone else. I know that there's some Ohioans that maybe have a physical reason they can't wear those, and that's fine. But for everybody else, this is something that we do for everyone else. And this is something that we do to protect others. And it is an additional layer. It's not a substitute for distance. Distance, mask, distance, mask makes a difference. And I think you're going to continue to see the numbers of our fellow Ohioans who are wearing these go up as they understand really what's at stake. What's at stake is lives. What's at stake is keeping other people from getting sick. And for those Ohioans who say, well, I'm not sick, what we know from now, empirically from testing, is there's a lot of people who walk around and they are carrying the virus and they have no idea they're carrying the virus. And so as Dr. Acton has said, we should assume everybody that we come in contact with has the virus. And if we act that way, then we will slow this down. I'm optimistic. Look, people are going to continue to do this at a higher rate every week.
Hi, Governor. Andy Chow with Ohio Public Radio and Television State House News Bureau. I wanted to revisit the issue of testing capacity versus how many tests are actually administered a day. Where's the state going with that? What's being done to make sure that the state's actually doing the tests that it has the capacity to do?
Very important. We did hit 10,000 a couple days ago. We're now averaging over 9,000 a day. I noticed in an article over the weekend that I read that we're not the only state that is not at capacity. There are a lot of states that are having that, but we have two jobs to do. And I told my team this again this morning. We have two jobs to do. One is to close that gap. And what the challenge has been, we basically have a capacity, what I will call a machine capacity at one level. That machine capacity shortly is going to be at 22,000 per day. That machine capacity is there. But what we're doing is we're building out, it's never been built before, we're building out a supply chain and distribution chain for swabs and everything else connected with that testing. And so we're focusing on that. The other thing, Andy, that we're focused on is at the same time taking that capacity even higher, because we know we're going to fill this up. We're going to keep going up and up and up and up. But we know that 22,000 a day is not where we need to be. We know that we have to be even beyond that. So two different functions, two different things going on. Our team is working every single day to make this happen.
This is Jackie Borchert from the Cincinnati Enquirer. Knowing that older Ohioans are probably the most at risk for complications of the coronavirus, why can't Ohio test all nursing home residents, or why shouldn't we? Other states in the last week have signed on to statewide testing plans, including retesting negative, people who test negative. West Virginia identified 28 new locations where the virus was through this action. So why isn't Ohio doing something like that?
We're going to test as much in nursing homes as we have the capability of doing. The protocol now is that anytime in any nursing home anybody has symptoms, they're to be tested. If they in fact test positive, then the tracing takes place and the more testing will take place, and to try to put the circle around that person, anybody that they potentially have been in contact with. So that is being ramped up dramatically. Again, with the pairing of the hospitals with these nursing homes. So that is a work in progress. Dr. Acton, you want to add anything to that?
No, Governor, your team is working. We actually are, as you know, many states were called to action to look at this, and we have a whole team that is going to be testing in all nursing homes. And they're looking into the subtleties of that policy, so it's something they're spending a ton of time on. I think we'll be hearing more about in the next day or two. So
let me just summarize. Our goal is to get as much testing in this state as we can. We're working on it every single day. The other thing we're doing is to deploy that, and my charge to our team is deploy the testing we have in a targeted way, most effective way. So doing two things, trying to raise that testing every single day, number of tests. But it's not enough just to raise the testing and just go out and test willy-nilly. It's important to take whatever capacity that is and to target that in the place where we can save the most lives. So I'm not satisfied where we are. We got to do more. We've come a long way, but we have a long way to go. And so we understand the danger. I understand the danger to people in nursing homes. I understand the danger to people in any congregate setting. Eric has given me the word here to close. Let me end with a song by Central Ohio band McGuffey Lane. The song is called Times Like These. Let's take a listen.
We're facing an uncertainty we've never faced before. Confusion's all around us. Fear is knocking at the door.